What is Pagetoid reticulosis? Pagetoid reticulosis, also known as Boehringer-Kohlhoff disease, is a localized, slow-growing variant of mycosis fungoides, or MF. What makes it interesting is that it usually presents as a solitary patch or plaque of MF on the skin, usually on the distal extremities, so meaning the hands, the feet, sometimes the lower legs, though I have also seen it present on other parts of the trunk as well. If the lesion is not solitary, it at least usually presents localized to just one area of the body, so maybe that 1 foot or 1 leg area. So this is in contrast to classic MF, where we're going to see patches and plaques usually over multiple parts of the body all at once. Historically, there was also a generalized variant that was described as being more widespread that was known as Ketron-Goodman disease, but that has now been reclassified as a different type of cutaneous T-cell lymphoma, or CTCL. This type of MF has also been reported in children, and there does seem to be a male predominance with about 2 to every 1 case in women. So if we remember our statistics, about 4 per million people in the United States per year get diagnosed with MF. So we're talking about less than 2% of those patients per year. And because of this, I would characterize it as a form of MF that is overall less known about and less known about among physicians. The largest single institution case series I could find was from Stanford, where out of a cohort of 1,500 cutaneous lymphoma patients, only 7 had Pagetoid reticulosis. So extremely rare condition. How is Pagetoid reticulosis different from MF? When we look at Pagetoid reticulosis under the microscope, we generally see more epidermal tropism than what we normally see with MF. This means that there is a population of abnormal cells in the epidermis, or the top layer of the skin, that goes beyond what we would normally see with MF. In fact, that is actually what the term pagetoid refers to. When we say pagetoid in dermatology, we are referring to an abnormal cell pattern where we see individual cells spreading into the epidermis. More commonly in classic MF, the abnormal cells are at the dermal epidermal junction, which is at the space between the epidermis, or the top layer of the skin, and the dermis, or the second layer of the skin. Pagetoid reticulosis also may have CD8 cell positivity, which is a type of T cell that is unusually present in classic MF CTCL. Generally, MF is going to be CD8 negative, so this might make Pagetoid reticulosis harder to differentiate and harder to classify when we're looking at it under the microscope. What does Pagetoid reticulosis look like? Pagetoid reticulosis may look quite different than classic MF CTCL. Generally, with classic MF, we are looking for large patches and plaques in the bathing suit areas, that is to say the hips, buttocks, and torso. The fact that Pagetoid reticulosis presents on the farthest parts of the body, particularly the legs and feet, is a little unusual. It can be even slower to grow or change than typical MF. Sometimes these lesions can be what we describe as verrucous, which means they have a rough or textured look to them, almost a warty look to them, which would be very unusual for typical MF. It may look like psoriasis, eczema, a bacterial infection, or a patch of stubborn dry skin on the hand or foot. Because of this, it might be even harder to diagnose than classic MF CTCL. In one review I looked at from an institution, 5 out of 7 patients with Pagetoid reticulosis had lesions present for longer than 10 years before a diagnosis was made. In these cases, the lesions can be severe and ulcerative because it has been so long before an appropriate treatment is chosen, with secondary complications such as infection being possible if the lesion is not appropriately diagnosed. What are the treatment options for Pagetoid reticulosis? If you get diagnosed with Pagetoid reticulosis, and this is your first visit with a CTCL doctor, they're going to start their initial workup with a complete history and physical review of systems and blood work to ensure that there are no other areas of involvement. Once they confirm that it is just a localized and isolated patch of MF involvement, we typically start by using skin-directed therapies, just as we would with classic early-stage MF. Now, this could include topical steroids, meclorethamine, and imiquimod, as well as phototherapy. Radiation has been reported with good success as well, and some studies show that this has the best results leading some experts to use this as first-line therapy. Usually, radiation is well tolerated with few side effects, and this can be desirable because it can lead to a long-lasting complete response in the skin. Sometimes when we look at pagetoid reticulosis under the microscope, we can see the cancerous cells invading into the deeper structures of the skin like the sweat glands. And because of this can occasionally make more superficial skin treatments such as topical skin creams less effective. So this is something important to keep in mind when discussing with your doctor. There have also been reported cases where the lesion has been so small that it was able to be successfully surgically removed with no evidence of recurrence. So this is something worth discussing in certain cases as well. What is the prognosis for pagetoid reticulosis? Pagetoid reticulosis is a subtype of MF that has a very good prognosis. Since it is localized and most of the time only presents as one lesion, it is generally considered an early stage form of MF. Uncommonly, there have been reports of conventional MF that have developed after the diagnosis of pagetoid reticulosis, but I would say that is the exception and not the rule. Dissemination beyond the skin has never been reported, and neither has disease-related death in these patients. In general, if you're diagnosed with this condition, you can expect normal life expectancy with multiple treatment options available that are variably effective. The most important aspect to consider is that the correct diagnosis is attained sooner rather than later, so treatment can be initiated.